Katrina, that's Katrina Yu there.
World experts on prostate cancer meeting in Melbourne have strongly backed the use of early detection testing for the disease. The test was controversially disendorsed by some medical groups in the US last year, but experts say it is still essential.
Andrew Upson says it was a simple blood test that saved his life.
If I'd just gone on with my life and not bothered to do anything about it, going to the doctor for my normal checkup, it could have gone unseen until it was too late.
The 60-year-old was diagnosed with prostate cancer earlier this year after having the prostate-specific antigen test, or PSA. The blood test can determine a man's risk of developing prostate cancer, but can also mean men who may not develop the disease are unnecessarily tested. Last year, some health authorities in the United States disendorsed the PSA test. But experts say this decision could prove fatal.
The PSA testing rates have dropped off, and what we therefore expect to see in the future is a reversal in the gains in survival we've seen over the past 30 years, and unfortunately we will see more men presenting with advanced cancer.
Even though more Australian men under the age of 55 are undergoing prostate cancer screening, experts say there's still a lot of confusion in the public about whether they should be tested. And some ethnicities are more prone to the disease.
Afro-Caribbean men are at particularly high risk. However, many men in Asian countries are not at higher risk, so pure Asian populations are not at higher risk. In Australia, we therefore have a mixed bag.
For some, fear of being tested may prevent them from taking action.
All of them are worried about going for a test, worrying about having an examination. And I had to say to them all, you don't get examined unless your PSA reading. It's just a simple blood test.
A timely reminder ahead of Prostate Cancer Awareness Month. Naomi Selvaratnam, World News Australia.
There have been calls for shield laws that protect journalists who use confidential sources to be made